All right, we're speaking with Gina Ayers on another drug overuse issue. This time, the concern that overusing antibiotics can lead to new and serious infection strains that are impervious to existing antibiotics. So you're talking about bigger issues than the familiar problem of parents demanding antibiotics for their kids' ear infections, aren't you?
Sure, so I think the concern that has come up in the public's eye, at least, is this idea of superbugs. So this sort of scary idea that there are going to be bugs and bacteria that are infecting people that you love or even yourself, and that maybe we don't have antibiotics that are going to be strong enough to help them.
And we don't have antibiotics that work because?
So we haven't seen that issue come up in our community here at St. Margaret or in the Pittsburgh area, which is exciting and good news, but it is sort of this concern and an issue that we've been dealing with throughout several years in the past couple decades is trying to stay ahead of the bacteria. So we do have appropriate medications now. It's just sort of a hypothetical concern that's come up in the public.
Well, don't we sometimes, well, let me ask this first. Don't a lot of these superbugs like MRSA, aren't they hospital-acquired infections? So does that mean that hospitals aren't doing enough to prevent them?
So you definitely can acquire bacteria, such as the one that you mentioned, while you're in the hospital, but it's definitely something that's on our radar and something that we're well aware of. And we have many things in place to prevent that from happening, and we're also constantly monitoring it to see how we can improve our processes even more.
So just a little fact checking here though. You said it's not a problem that you have here, but a few years ago, some of the UPMC hospitals were penalized by Medicare for their hospital-acquired infection rate. What has UPMC done since then to improve the situation?
Sure, so I can speak to St. Margaret specifically and just say that we have an infectious disease pharmacist specifically who's monitoring our antibiotic usage and coming up with new programs and new protocols for ways to limit antibiotics so that we're only using them when they're appropriate and we're minimizing the use of them in general if possible.
Okay, thank you. All right.